There is a fascinating test that is safe, easy, and painless, and it can find breast cancer earlier than any other screening test.
NBC 10 News medical reporter Sherry Banks saw it in action today, and Sherry's here now to tell us all about it. Sherry?
And Tim and Renee, it looks wonderful. I mean, it's really interesting to see. And the doctor I spoke with calls it the best diagnostic test hardly anybody knows about. It's thermal breast imaging, and he says it can find abnormalities suggestive of breast cancer as much as 7 years before you can find or feel a lump. Here's how it works. 2 of her aunts had breast cancer, so Nancy Patterson's been worried about herself.
And it really bothered me because I didn't want to add breast cancer to my diabetes and cardiovascular disease that I already have.
That sound you hear is the camera focusing.
So Nancy decided to undergo thermal breast imaging, where an infrared camera looks at the heat patterns given off from your breast, and doctors can see abnormalities in circulation. These 2 breasts should look the same, but don't. The doctor says there's a problem with the one in green. The green one has a lot of blood rushing to it, which means
that something is ongoing, because the body will send blood and white blood cells to areas where it's trying to fix a problem.
The black and white pictures let the doctor see actual blood vessels and whether they're symmetrical. A few days after your thermal breast imaging, the doctor sends you a hard copy of your images, both in color and in black and white. And he also sends you a report. And then you make an appointment to have a consultation on the phone so he can explain to you what you're seeing here. Dr. Philip Getson thinks thermal imaging should be done before a mammogram.
This can find abnormalities suggestive of breast cancer as much as 7 years before a mass is palpable or a lesion is identifiable on mammography.
Just straight up.
Then women could get regular exams.
So that when the changes begin to become evident, we catch them day 1 and not when the mass has already been there for 6 months or a year.
The cost is $250. Insurance pays sometimes.
Medicare doesn't pay for it, but it's the best money I ever spent. My life is worth more than what it costs.
This procedure is non-invasive. There's no radiation, no injection, so obviously it doesn't hurt. Nancy found out she's clear, which was a great relief to her. To find out more, come to NBC10.com and click on Health Watch.